and he was unique in starting many de-addiction centers in Chennai city, which are very successful in raiding, recovering a lot of people. We have started shelters for the beggars. We gathered and collected more than about 5,000 beggars around the streets of Chennai, and he was instrumental in grooming them up. He himself cleaned them, he groomed them, and we started shelters for them. And also, when I was a communicable disease hospital director, he really pioneered a lot for its development. And I don't know how many of you know, he made a Asian Book of Records in marathon, crossing more than 500 marathon races. Even the last week when myself and VP went to his house, he was preparing to go to Bihar. He ran his race of 21 kilometers. Simultaneously, his son in London ran, and his grandson also ran and got these great awards. Such a wonderful personality, and he was ranked to be the most fittest person in the country among the smartest cities about a month back. These are all his credentials. There are no roads or the lanes left in Chennai without being witnessing his visits during his tenure as a mayor. Similarly, other unique personality is our health secretary. I worked with him under him as the director of Communicable Disease Hospital. Also, when I was in UNICEF, I was able to see and witness the greatest service he did during tsunami in Nagapattinam as a collector. He still has got lots of orphan children adopted by him, and recently he got them married also. Such a wonderful, great human beings we have on the stage. To put it in a brief, this particular program was conceived by our chairman, Mr. Ravi Pachamuthu. It is to reduce human sufferings from our people. மனித துயரங்களை குறைப்பதற்கு சிம்ஸ் மருத்துவமனை எடுத்திருக்கின்ற மிகப்பெரிய முயற்சி. We need not stick only to the ivory towers of the hospital. With Sims Hospital, we should also go to the field and work for the people. This Hello Doctor scheme is nothing but extended arms of the hospital to reach the people at home. So, as a unique event, we started seeing the discharged patients from the hospital to their houses and groom them with follow-up. That is what we conceived, and we did a trial, and it is now being inaugurated with the big personalities here. So discharged patients are followed up till their suffering, and again we want to extend our services to the geriatric patients, elderly patients. Actually, in India, the second state which has got more than 60 years people living is next to Kerala is Tamil Nadu, and Chennai it is highest. All the people above 60 years require home care. There are people who are not able to come to the hospital. They need care at home. So, to extend our services to their doorsteps, we wanted to do for the geriatric care, and again palliative care, and people suffering from chronic ailments, people who are not able to come to the hospital. A lot of NRI sons and daughters, they call us and they ask us to take care of their parents at home. So this is the procedure that we would like to follow in Hello Doctor. Once the call comes to our hospital, 2001, our coordinator will really organize the team of doctors and the nurses to visit to the houses and take care of them, the chronic ailments. And in emergency cases, the patients are counseled through telemedicine. We got a system of televideography. Through that, we counsel them, pick them up early for immediate intervention. This Hello Doctor scheme has also got Wi-Fi connected ECG machines. We have got phlebotomy lab services at home, supply of drugs to the elderly at the doorsteps, and also physiotherapy, counseling, telemedicine counseling, and if possible, the senior doctors who are the world celebrities who are working in the hospital could also be talked through video conferencing. We got a SIMS app also. This hospital is the first of its kind to start a social medicine department among the corporate hospitals, which has got international travel clinic and vaccination center, which is affiliated to the International Society of Travel Medicine, which is an organization of WHO. We give certificates for the people going abroad, vaccinating them, advising them, and also who are coming down to India for visits. So I would like to request you all to really propagate this idea of Hello Doctor scheme, to reach out the people who are suffering at home, and we can extend this expertise to the doorsteps.